everyone, welcome to TryRide. This is Pack 365 and myself Srija. So today you're going to learn about the conventions and general ICD CM official coding guidelines. So coming to the first one, other and unspecified codes. So what do you mean by this? So when coding diseases or conditions, sometimes the medical record doesn't give a perfect match for a code. So that's when we use the other or unspecified codes. So coming to other codes. Other codes is also called as other specified. So this is used when the doctor gives specific details, but there is no exact code for that condition. So in the ICD-10 book, you'll often see NEC means not elsewhere classified. So this means other. For example, if the doctor says viral infection of the lung, but there is no exact code for that type of virus, so you will use another code. So in short, we know what the disease is, but the ICD doesn't have a precise code for it. So then you have to use the other code. So now coming to unspecified code. So this is used when the doctor didn't provide enough details to choose a more specific code. For example, if the record just says lung infection, so without saying what kind of lung infection it is, so in that case you have to use an unspecified code. So we don't have enough information to be more specific. So when there is no enough information, we have to use this unspecified code. So coming to next convention, include. So include, this note appear right below a 3-character code in ICD-10 book. So what this include note explain? It explains what is covered in that category, or it gives the examples of what belongs under that code. So think of it as a helper note that tells you this code includes these specific conditions. This code includes these specific symptoms, right? For example, if you see code J00, which describes the acute nasopharyngitis disease. So this include note might say includes common cold, acute coryza, acute rhinitis. This means these conditions are part of a JOO code. So all these are included within the JOO code. So you have to code only the single code. You need not to have several codes over here. So next to inclusion terms. So what do you mean by inclusion term? So these are the list of words or conditions which are found under some codes. So they tell you the specific conditions that the code can be used for. Sometimes they are also the synonyms of the main code title. For other specified codes, they show the examples of conditions that fit under that code. So inclusion terms are not a complete list. There may be more related terms found in the alphabetical index. So that also use the same code. So include note, it explains what part of that code category, whereas inclusion terms, it's a list of conditions that uses the same code. So this is the difference between include note and inclusion terms. So next coming to exclude note convention. So what do you mean by exclude note? In ICD-10 CM, exclude notes tell us when certain codes should not be used together. So they help preventing coding errors by showing that the same conditions are not related. They can't happen together. So this exclude notes, there are two types. What are they? Exclude 1 and exclude 2. So exclude 1, it's a pure exclude note. It means it is not coded here. So you cannot use the excluded code and the listed code at the same time, because they represent the different or mutually exclusive conditions. For example, if one code is for congenital condition, congenital means present from the birth, right? And the another is for an acquired condition, it is developed later after the birth. So you can't code both together, right? You can't code the congenital condition and acquired condition together. So this comes under the exclude 1 convention. So if the two conditions are unrelated, then both codes may be used together, but only in the special case. So this is the specialty of the exclude 1 convention. So next coming to, so sometimes it's not clear if two conditions listed under an exclude 1 note, so which are related or unrelated. So if you are unsure, you should ask the healthcare provider for clarification. So whenever you didn't get enough information to code it, So you just ask the healthcare provider or just query them for the clarification. After a clear clarification, you have to code them. So for example, code F45.8. So this denotes the other somatoform disorders. It has an exclude one node for G47.63, which is sleep related teeth grinding. So because teeth grinding is already a part of F45.8, so this is an inclusion term. So if the patient has teeth grinding, so use only code either F45.8 or G47.63. They should not be coded both. Just use any either of the code. So if the patient has psychogenic dysmenorrhea, a different condition also under F45.8, and a sleep related teeth grinding. So these are unrelated conditions, right? So in that case, you can use both codes together, F45.8 and G47.63. So when conditions describe the same thing, it is a related one, so use only one code. If the two conditions describe different problems, so the relationship over here is unrelated, right? So you can use both the codes. So if you're not sure whether the conditions are related or not related, so ask the provider for clarification before coding, right? So coming to etiology and manifestation convention. So what do you mean by etiology? It's a cause of disease. So what is manifestation? It's a result or symptom caused by that disease. For example, diabetes is a cause. So diabetic retinopathy is the manifestation in the eyes. So what are the coding rules? When both are present, you will see a note saying use additional code. So next to etiology, cause code. So you will also see code first next to the manifestation code. So this tells you the order to code. First the underlying cause, which is nothing but the etiology, and then the resulting condition, which is nothing but the manifestation. So many manifestation codes include this phrase in their title, in diseases classified elsewhere. So this means that these codes cannot stand alone. They must be used with another code that shows the cause. So they are never used as a first or main diagnosis code. So what is the important rule during coding manifestation and etiology? Always list the underlying condition first, followed by the manifestation. So both codes must be used together to fully describe the patient's condition. For example, diabetes causing kidney disease. Here, etiology is the diabetes, whereas manifestation disease is kidney disease, right? So you have to code the diabetes first because it's an etiology and it's an underlying condition. And kidney disease, it is a manifestation, right? So this can be coded next to the etiology. So example of this manifestation and etiology F02. It's a dementia in other diseases classified elsewhere. So this is an example where a manifestation code is dementia. This can be linked with the cause. Cause is nothing but another disease. So when the title doesn't say in diseases classified elsewhere, some manifestation codes don't include the words in disease classified elsewhere, but the same rule still applies. You will see use additional code note beside the etiology. So code first, not beside the effect or manifestation code. So always list the cause first, then the result. So how it appears in the ICD book? The tabular main list. The main list of codes will show these instructional notes. The alphabetic index, it also gives a hint on the order. So it lists the etiology code first and the manifestation code in the brackets, meaning that code is always used second. So what is the easy way to remember? Cause is effect. Etiology is manifestation. So etiology must always be coded first, followed by the manifestation. For example, if the alphabetic index says diabetes, the disease Parkinson's dementia in F02.80. Here, code G20 first for Parkinson's disease, it's the cause, and then code F02.80, it's dementia effect. So coming to next slide. So here's another example of code first and use additional code. Parkinson's disease G20, it's a cause or etiology. Whereas dementia, F02.80 or F02.81, it's the manifestation, it's the effect. So here, Parkinson's disease G20 should be coded first and then code dementia due to Parkinson's disease, nothing but F02.80 code. So this shows the proper order or the proper sequencing of the coding. First the cause, then the result. So the other uses of code, first time use additional code. What are the other uses? So these notes aren't only for the cause and effect cases. So they are also used when more than one code is needed to describe a single condition. For example, a main disease plus its complication or detail. So this is about the code first time use additional code convention. So coming to next the word and, the and convention. So in ICD-10-CM, the word and in a code title means both and or. So if a title says bones and joints, it covers tuberculosis of bones, tuberculosis of joints and tuberculosis of bones and joints. So all of these are coded under A18.0, nothing but the tuberculosis of bones and joints. So this is about the and. Next coming to with convention. So what do you mean by with convention? So in ICD-10-CM, the word with means associated with or due to. So you will see it in code titles, also in the alphabetic index, also in the instructional notes in the tabular list. For example, diabetes with neuropathy. So what do you mean by diabetes with neuropathy? Neuropathy is caused by diabetes. So diabetes is the etiology, whereas neuropathy is the manifestation, right? So what is the automatic relationship? So ICD-10 assumes a link between two conditions listed together, with or in. So that means you don't need the doctor to write due to. The relationship is automatically understood by the coder. So when not to assume the link, only ignore the link if when the provider clearly states that the two conditions are unrelated. Unless and until, you should not give the automatic relation. So there is a specific coding line that says a clear link must be documented, like in sepsis with organ dysfunction. So when documentation is needed, if conditions are not connected with or in the ICD book, then the doctor must clearly state they are related before you can code them as much. So for your better understanding, I will give you 3 easy examples. The first one, diabetes with kidney disease, it is automatically related. Hypertension with heart disease, it is automatically related. Sepsis with organ failure, here link must be proven by documentation. So this is the perfect example of the with convention. With is nothing but due to or associated with. So assume the link unless stated otherwise. If no with the term, provider must confirm the relationship. So next convention is C and C also. So whenever you see C after a main term in the alphabetic index, it means you must go to the another main term to find the correct code. So you cannot code from the original term directly, you must follow the direction. So for example, if the index says cyst skin, C also disease skin. So you must look under disease skin to find the correct code. So C means go there for the right code. C also instruction. So what do you mean by C also instruction? It means there is another related term that might give you more options or information. You don't have to go there if you already found the correct code. So if the index says ulcer, C also own. So you can stay under ulcer if it gives the correct code. But if not, it gives the correct code, you may also check under own. So C also equals to optional, check for more information if needed. So C is you have to must follow the action. C also it's an optional action for you. Whenever information is needed, this C also convention must be followed. So this is about the C and C also. Next coming to code also note and default codes. See code also. So what does this code instructs? Its code also note means that it's a two codes might be needed to completely describe a condition. However, there is a note that does not tell you order. So which code comes first? So the sequence depends on the specific situation or encounter. For example, if a patient has diabetes with kidney disease, you may not need to code both the diabetes and kidney condition, right? The order depends on which is the main reason for the visit. So what reason is the main for the visit, that should be coded as the primary code. Okay, so the sequence always depends upon the main reason for the visit. So code also means it use both codes if needed, but order depends on the case. You got my point, right? So default codes, then default code is the code shown next to a main term in the alphabetic index of ICD-10-CM. So what does this default code represents? So this condition, it stands for the condition that is most commonly associated with the term, or it is the unspecified term on it, unspecified version of it. For example, when a documentation says just appendicitis, so that doesn't mention the either the appendicitis is acute or chronic, then you have to use the default code for appendicitis, which usually refers to the acute. So if the record doesn't give more details, so use the default code next to the main term. So this is about the default code convention. So next, coming to the code assignment and clinical criteria. So what does it mean? The diagnosis code is assigned based on the provider statement that a condition exists. So if the doctor says the patient has a particular disease or condition, that is enough for coding. So you don't need to check whether the provider used certain clinical tests or criteria to make the diagnosis, right? So coding is based on the documentation, not on how the provider diagnosed it. So if the medical record has conflicting information, the coder must ask the provider for clarification before assigning a code. So whenever a conflict or a confusion arises, you must query the provider before assigning a code. So this helps you to in accuracy, maintaining the accuracy. If the doctor writes pneumonia in the patient's record, you assign the pneumonia code, even if lab results are not shown, because the provider statement itself is sufficient. In the same way, not always a clinical test or lab reports are necessary. If the provider himself gives the condition, gives the disease in the description, it is enough for coding. So this is about the code assignment time, clinical criteria, convention. So this is all about today's session, guys. In tomorrow's session, you will be learning about the general ICD coding guidelines. Thank you.